I want to explain a little bit more about the functional lab tests I do and how they are different than the blood work that your doctor does. So, functional lab tests get their name because they show us how different systems in your body are functioning. So, everything from hormones to your gut to minerals to food sensitivities and more. Doctor's blood work, on the other hand, is very specific and meant to diagnose a disease or disorder. Whereas with functional lab testing, I'm looking more at the big picture of how all the systems in your body are working as a whole. So we can find out everything that could be contributing to your sleep issues. Now, another way they're different from your doctor's blood work is how I interpret them. So when you get blood work done by a lab, it comes back and shows whether you are in the lab's normal ranges or not. Now, this range is based on, first of all, an average of the people who are taking the test. So the average is in the middle, and about 25% on each side is what's called normal. Now, the first problem with this is that there are mostly sick people who are taking these tests. So take your thyroid test, for example. It's mainly people with symptoms of hypothyroidism or hyperthyroidism that are taking the test. And so that makes the results very skewed. And what's normal is then very big. Now, the other difference in how I look at this is that we don't want to be normal. We actually want to be optimal. And I've been trained on what the optimal range is, which is a lot narrower than this normal range. And optimal means that you are in health without any symptoms. And obviously that's what we're going for. So that's what I am looking for with these tests, is to seeing if you're in the optimal range or working to getting you back toward optimal. Now, another difference between doctor's blood work and these tests are how I interpret them, and well, actually how I deal with the results. So first of all, I'm never just treating the paper and saying, you have this, let's do this. I look at the whole person, what's going on with your symptoms, your health history, and these labs. How do they all correlate with each other and fit together and make sense? Secondly, say that you have high cortisol at night, which is very common with people with sleep issues. I am not just going to recommend a cortisol lowering supplement. I might, for the short term, to help you sleep better, but in the meantime, I want to know why your cortisol is high. And that's what these lab tests show. Is there a pathogen in your gut? Are you eating foods you're sensitive to? Is your blood sugar dropping too low? So any of these things can cause your cortisol to be high at night when it shouldn't. And if we don't find out what's causing it and then work on correcting that, then you're going to be taking cortisol lowering supplements forever. And another thing is that cortisol, your body releases cortisol for a very good reason. When you have inflammation, cortisol is anti-inflammatory, and so it helps deal with that inflammation. And so to suppress that response is not helping things. It can actually cause more harm than good. That's why I use these tests. I like to test instead of guess, so that I know exactly what to recommend. Instead of trying this supplement and that supplement and seeing if it works, the tests show exactly where your weaknesses are in your body, so we can work on correcting them so that you can sleep.